So we are just going to discuss interactively the economics of epidemics. I'm supposed to make a presentation on financing infectious disease outbreaks. So what's cost effectiveness of prevention? We all know that prevention, even the oldest woman in our villages know that particular saying, prevention is better than cure. But here we are saying prevention, we are just interposing prevention with cost effectiveness. So we are saying prevention is more cost effective than cure. It's the same thing as saying prevention is better than cure. So, but there's one thing I want to point out. Cost effectiveness doesn't necessarily mean that it is cheaper. We need to understand this. Because many times, talking from a political point of view, that's why governments run away from prevention. Many times it's actually more expensive, but it is more cost effective than cure. So we have to understand the economic benefits of these preventive health interventions, and it enables policymakers and project managers to make better informed decisions. Many times our domestic resource mobilization is from governments, is from policymakers. So it's important we get them to understand this in a language they themselves would understand. We come here, we sit down, we have these very beautiful things in our head of how government should work. But as soon as we leave this room, many times that ends there. Or another way is that we cannot get through to them to understand why they need to fund things like this. For example, we are talking about the Ebola outbreak. Why was it that immediately that thing came up, within 1 week, the federal government released 1.9 billion? The state governments, Rivers State government released almost the same thing. Lagos State government released almost the same thing. My state, Cross River State, also released. In fact, my governor then was panicking. Why? Because the man was actually coming to Cross River. He was coming to Cross River State for an ECOWAS event. So you can imagine, and we're all saying, God, if this man had reached Cross River, a lot of us would have died because we were not prepared. And then, of course, he would have gone to the presidential villa. He would have shaken hands with the president. Definitely, he was a diplomat. So the president knew that if this man had reached where he was, definitely he would have met the president. And a handshake is very official. And that's how, even in a fortress like the presidential villa, where no security person can penetrate, no person with a gun can go in, Ebola would have entered and, God forbid, killed our president. So these are the things that we should understand and get across to them. Many times politicians have two things in their head when they are funding things. One is, how will it benefit me personally and my people? We reel out a lot of statistics to them. It doesn't mean much to them. They want to know how it affects me and my people. Second, and more importantly off record, how will it get me re-elected? How will people see what I have done? Prevention is not tangible. Politicians want to build infrastructure. What people can see and say, yes, this man has done this thing. So when we're talking of stakeholders, everybody is a stakeholder in health. Nobody should be underestimated. Apart from the policymakers, the president or the governor understood a need why that hospital should be built in Ukem. But the people did not understand. So despite the fact that we had built that beautiful hospital, put everything new state of the art, nobody went. Because there, in their tradition, if you go to a hospital, you're considered weak. So in the first place, no man will go there. Because nobody wants to be considered weak. So now, after the hospital has been built, we're now putting the cart before the horse, or the horse before the cart. Well, this is when we are now starting to sensitize the people on why they should get to that hospital. So, of course, the extent of economic burden can be understood as comprising three components: direct costs, indirect, and value of the morbidity and mortality. Many times we want to know the direct costs. But we need to get to explain to the people many times that bring out the funds that indirect cost also matters. Yes, he brought out 1.9 billion naira. But what if the man had shook his hand and he actually had the Ebola? Would he have survived? Or even if he had survived, what of the number of times he was going to be in the hospital trying to recover? And of course, the value of morbidity and mortality. Life is priceless. Once you're dead, we are dead. We lost one of our best doctors in Nigeria, Dr. Adadevo, for, something that probably would have prevented, starting from the man's own governments. So also talking of the three components, We have mentioned direct, indirect, value of morbidity. And for government, the National Health Act actually makes provision for consolidated revenue 2.5% to NCDC. It's in the National Health Act. Has this been implemented? 2.5% of consolidated revenue fund of the government is supposed to go to NCDC for management of epidemics. The budget was just signed into law, 2019 budget in May 2019. This is like 5 months after, at the end of May. And you know how it is with budgeting. Sorry, sir, I know this is your field, but I know that in budgeting, I don't think you can implement a budget for a year without the president signing it. But there are some parts of the budget you cannot implement because the president has to accent. So what if you need to do something before May? Sometimes, even in the state, it's signed long at the end of the year. The budget for a year is signed out. And I keep wondering, why can't we sign a budget like December or 1st of January or January for a budget of that year? It means that you can never reach the full potential of that budget, no matter how hard you try. And of course, also, the Basic Healthcare Provision Fund, the one that it's on right now. 50% of that fund is supposed to go to National Health Insurance Scheme, 45% National Primary Healthcare Development Agency, 2.5% to the Ministry of Health, Federal Ministry for Accidents and Emergencies, another 2.5% to NCDC again for management of epidemics. So it's not like we've not planned. I keep saying the problem we have in Nigeria is implementation. We have beautiful, beautiful planning models. But after we leave here, how do we get to the people that need to release these funds to be implemented? Every month, the WHO receives 5,000 early warning disease signals from across the globe. 300 of them need further investigation, and 30 warrant more in-depth field studies to investigate the potential. Of course, the number of infectious outbreaks has increased over the years. Many times, even if the infection prevention mitigation, many times we wait for partners to do this for us because of the costs. For example, take Ebola, for instance, or say Lassa fever. I heard the MC talking about Ebola and Lassa fever. The reason we all know why Ebola receives such attention, because anybody could have had it. Lassa fever, somehow they think is a disease of the poor. Why? Because, I mean, a rich man many times does not have rats in his house. He has good sanitation. But there's a way you can also talk to him. How do we prepare, say, fura, the northerners, fura? You have to dry something on the ground, on the floor. So even if it's the president, the governor, whoever is drinking fura, that thing must be dried on the floor first. So you can get to him by telling him, you see this fura you're drinking, don't think it just came well prepared like this. It was dried on the floor. You can have rats dropping, rat droppings on it. They can urinate on it. And you can still have the same Lassa fever. So do not think it is a disease of only the poor. Dried fish. These days, even dried fish, it's only big men that can afford dried fish. It's the same thing. You dry it on the ground. We need to get to their conscience, get to a way of getting them to understand why they need to fund these projects. I was talking about Ebola. For example, trainings. The Minister for Health some time ago said any health worker that dies from an infection, maybe in the laboratory, many times it's the person's fault. It was taken out of context, but I think it's actually true. Era where Lassa fever is managed, everybody would have died if they did not take very adequate universal precautions on it. So many times they are like, okay, Commissioner for Health, give me a list, a bill. I'm saying, oh God, please, we need to prevent, we need to train our health workers, capacity building of our health workers on why they need to be trained, how to manage Ebola, how to detect and all that. Okay, no problem. You've disturbed me too much. Bring the budget. We have like 1,000 health facilities in Cross River State, primary, secondary, including health posts. Your Excellency, to do a training with simulation and everything of these health workers will take 500,000. Times 1,000, 500 million. What? Commissioner, I beg, carry your paper. And it ends there. That is the, I'm telling you, this is how it works. We come here and say training of health workers. Who will you train? Who will you not train? Many times it can even come from the lower cadre health workers. So what do? How do you get them to understand that's important? That's why I mentioned that prevention is more cost effective but may not be cheaper. And my governor will be like, really? This is just an example, not like it really happened. And he can tell me, okay, 500 million to train people. Let's wait now. When the Lassa fever comes, is it no ambulance? We will put the person inside, find ambulance with everything inside. Take the person to Ira. How much will it cost? A maximum 100 or 200,000 per person to get somebody to Ira. NCDC is even doing free sample transfer. So that one self is out. That is how he will think, and that's what he will do. He will not do any training of 500 million. He will rather wait when it happens. He will take the person in an ambulance to Ira, and we keep hoping and praying that the person gets well. So this is just how it works. Sorry, this is my slide there. Many times I'm just talking to it. You know, I had to make this a bit more scientific, but I'm talking like a politician now. And so for domestic resource mobilization, we have that government. We need to get to them in a language they understand, very important. We also have stakeholders, like I mentioned, the hospital in Ukem. Everybody has to understand why health is important, why they also need to prevent, you know, and help themselves to make sure they themselves don't get illnesses and transfer to their loved ones. Another important thing is the political class, apart from government, and of course the rich men. For example, everybody knows Dangote, Otedala, and all that. They've been doing a lot. But you know that abroad, if you are that rich, in fact, everybody, it's mandatory that you carry out those welfare activities. It's not a luxury. So you see many times people coming from abroad to do free medical care for us. Many times they get back there. It helps you with your tax. When you show a bill or a list or pictures or whatever of what you have done for people as welfare, your tax is reduced. So everybody tries to do that. Why can't we make it mandatory also? We should not wait for Dangote and Atedala or Delegate to do everything for us. If it's mandatory and there's an incentive for people to actually say, okay, like the tax thing, everybody, when you're going to you check your tax returns and all that, you show what you have done for people. In that way, they calculate and reduce your tax. So abroad, everybody does it. We can also make it mandatory. Another thing we did for the political class in Cross River State, we have the Cross River State Health Insurance Scheme, Ayadeke. This scheme started, and we're like, how will we get more people to pay for this scheme? It's supposed to be 1,000 naira per month, 12,000 per year. Everybody can still not afford it. And it's mandatory, official and non-official. So we did not say, okay, if you're a director or percentage of your salary, no, because we wanted everybody to come into that scheme. And then on the day of the launch, on the day of the signing into law of that health insurance scheme, my governor was like, okay, everybody, you have to donate to this scheme. He started. So it's like the only bill that the governor was signing into law that was launched in the states. I don't know if any other state has even done a launching for a bill that was signed into law. But it was an innovative thing. And everybody came out and donated. I went ahead to say, adopt a person, adoption tree for the health insurance. Adoption tree means you're a House of Assembly member. You keep saying you're going to do things for your people. Adopt 100 members of your community. You'll be paying this 1,000 for them. Adopt a health facility, primary health facility. We have 1,000. That's a story for another day. All those 1,000 are not functional and operational. We are working on them now. So we say to increase the number of functionality of health, primary health centers, we say adopt a primary health center. We know our politicians, we know what they like. Please write it boldly. Senator Gershom Bassi renovated this PHC like this big. Everybody passing there will see that senator. And it worked. Because politicians want people to see what they've done. That is always it. Because they need to go back for re-election. Reduction in prevalence, who sees that? It's not tangible. So the people don't even understand what you have done. But they have seen that mighty hospital, Ayadeke Referral Hospital, okay. He's really working. The governor is working. You know, so okay, they see Senator Gershom Bassey has renovated this place. Okay, Senator Gershom Bassey is working. He deserves a second term. And it helped them. If you tell them to do it like that without putting their names, they will not do it. So it actually helped us to get more of our primary health centers renovated. Adoption tree also helped us to get more of our people. We're in the enrollment stage now. It helped us to get more of our people enrolled. Because almost mandatorily, you cannot, I mean, if you're 25, 18 people are doing it, your people will start saying, now what for you? We put you there now, you want us to vote you next time. Imagine the other House of Assembly member has actually paid for 10,000 or 1,000 people. So multi-sectoral collaboration is very important. For example, in the road, we know about all the 3 delays of getting pregnant women to the hospital and all that. One of them is access to the road network. You can work with the Commissioner for Transport and get these roads done. You can work with the Commissioner for Transport to find a way of providing medical, like vehicles. Something we did in Cross River State with our pregnant women. We worked with the taxi union, taxi and motorbike union. So every time we got their numbers, the numbers of these people. So if a pregnant woman is in a community, you just get, when you come to the health facility to register, we give you somebody's number, some numbers that you can call. So once you're in labor, these people come. We have actually rewarded a taxi man who had a full load of people ready to move and was called. And he made sure everybody disembarked from that car. And he went and got that pregnant woman. So those are the kinds of things we're talking about with multi-sector. It's not only governments. So agri sector, we have in Cross River State, we have a beautiful rice seedling farm, rice seed and seedling farm, where we are working, the Ministry of Health is working with the Ministry of Agric on vitaminized rice to improve the health of the community. So we are talking transport, we are talking agriculture, and we are talking power. The Cross River State, the Ministry of Power generally to work with the Ministry of Health on power supply. I mean, in Nigeria, no power supply is an issue everywhere. So it's the same thing in Cross River State. So we also somehow got solar. Working with some of our partners, we're able to get little solar lamps that these women can use in rural communities to make sure that every time a pregnant woman comes, there's actually light. So it's important to understand this collaboration of various stakeholders. Multi-sectoral could be anybody and everybody. Private, public, governments. Collaboration is important. Ministry of Information. We cannot underestimate the value of Ministry of Information. Information management during the Ebola crisis was very, very important. So we have to understand and improve the health of a population. And this cannot be the sole responsibility of the healthcare systems alone, or rather one sector. It's the responsibility of everybody, public, private, policymakers, to promote long-term health. Thank you very much.